Hello. I was inspired by other videos I saw on YouTube of people talking about how they felt after their osteochondroma removal surgery. So I decided to post a little bit about my own experience because it's a rare thing. It's not a lot of information about it, but plenty of people have to go through it. I was diagnosed with a benign osteochondroma on the bottom of my right femur, very close to the kneecap, about 12 years ago, but didn't have the time to take off work and recover from it. But because of the pandemic, I don't have a job and had time, so figured I'd get it taken out before I lose my health insurance. Yay. I was a little overly optimistic on how my mobility would be after the surgery. It's a bit more painful, a bit more limiting than I thought, which makes sense. They sawed off a piece of my bone, um, but it's tolerable. It is a Friday morning. I had the surgery for the tumor removal Monday morning, and got home Monday afternoon and still had nerve blockers in my leg and the other great hospital drugs. So foolishly, I got up and walked around on it, and that turned out to be a big mistake because even though they sent me home with Percocet, I did not stay on top of it, and I had an excruciatingly painful night Monday night when the hospital meds wore off. So anyway, that was rough, but that taught me to not do too much too quickly because the bone is quite tender and very swollen. But it's been better every day. I started doing the recommended knee exercises on Wednesday, about 2 days after the surgery. Um, just knee bends, moving my foot back and forth. The foot is connected to all the muscles in the leg. Um, Obviously, I'm remembering all these things. I'm like, oh, what? It's all connected? Yeah, it's all connected. Anyway, just slight movements. Just today, I walked around with a cane, tried not to overdo it. And the swelling is getting better, but I'm going to be limited probably for at least a couple weeks. And I don't really know when I'll be back to normal. I was quite into jogging, and I don't know when exactly I'll be back into that. But I just wanted to say to anybody who has this surgery, um, if it's near a joint like a knee or a shoulder and it causes pain, I would recommend, if you can, to get it removed because, as we get older, it's not gonna feel much better. Um, but the surgery is no joke. It really is not, and it's the pain on Monday night was more of a really intense growing pain, sort of a pulsating kind of pain. And now it's just sort of a stiffness and an ache that comes with the movement exercises. But my scar um, on the above the kneecap, on at the excision point, is about 3 inches long. The surgeon did a great job. Very skillful with the stitches. Um, but I'm feeling good. After Monday night, I was able to sleep um, very well. 3 nights in a row. Wake up maybe every 4 to 5 hours with some soreness, and I'll take a Percocet. And the side effect of those is really vivid dreams. I didn't know that. Now I do. Um, but this surgery is not the most intense thing ever, but it's also nothing to be taken lightly. So, to anybody who has one of these and is thinking about getting it removed, don't be scared, don't be nervous, but just know that it may be a longer recovery time um, until you can get back on your feet and get as mobile. If you have it removed on your knee, around your knee area, as I did, it's a common place for these kind of tumors. Um, but yeah, so far so good, and I'm just gonna keep it moving, and keeping the knee moving is a way to prevent accumulation of scar tissue, which could be just as bad as the tumor. Kind of stressed. I don't want to mess this up. But good luck to everybody, and you know, don't be scared. Don't be wigged out by it. It'll be fine.